So in this lesson, we're going to learn about HIV or AIDS. First, we're going to state the name and the type of pathogen that can cause HIV or AIDS, and explain how HIV or AIDS is transmitted, and then discuss the social, economical, and biological factors in the prevention and control of HIV or AIDS. So what is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. So therefore, AIDS. Okay, so AIDS is not a disease. So whenever you come across the word syndrome, syndrome is a group of symptoms that occur together. So it is called a syndrome. Why is it a group of symptoms? Because you've got a group of opportunistic disease that occurs in the body at the same time. So it leads to a group of symptoms. So AIDS is what? AIDS is actually a collection of very rare opportunistic diseases. So it's a group of diseases leading to a group of symptoms. Okay. And this rare opportunistic disease will only develop in a people because of immunodeficiency that is caused by HIV infection. So first, HIV infects the person, and after infection, it causes the immune system of the body to be weakened. After immune system is weakened, it will lead to opportunistic disease. That means the pathogen take the opportunity of the body that's weak in the immune system and cause disease. So that's why it's rare among normal people. So that will lead to AIDS, which is actually a collection of the rare opportunistic disease developed due to immunodeficiency caused by HIV infection. So HIV doesn't cause AIDS. HIV causes immunodeficiency. And because of that, the opportunistic disease is the one that leads to AIDS. Okay. So first, we want to look at the structure of HIV. I didn't introduce the meaning of HIV. Human immunodeficiency virus. HIV stands for Human Immunodeficiency Virus. So this virus can lead to AIDS. This virus can lead to immunodeficiency, which eventually leads to opportunistic infection and therefore AIDS. So HIV is a retrovirus. Now the word retro, okay, stands for backwards. So what do you mean by backwards? Now we have learned that DNA, right, is always used to synthesize RNA. Okay, but backward means now the DNA is used to synthesize, the RNA is used to synthesize DNA. So forward is called transcription. Backward is called what? Can you type the answer? Backward
Translation.
No.
Oh no.
Is it reverse transcription?
Yes, reverse. Backwards means when you reverse your card, reverse of the transcription. Okay, so forward is transcription, backward is reverse of the transcription, so reverse transcription. So reverse transcription will be catalyzed by the enzyme called reverse transcriptase. Okay, so this is the enzyme that will catalyze conversion of RNA to DNA. Okay, so retrovirus is called retro because it is able to catalyze the conversion of RNA to DNA. So why? Because its genetic material is in the form of RNA. And when the RNA is introduced into the whole cell, the virus will use the whole cell as a machinery or as a factory to convert the RNA to DNA. So this happens in the whole cell. Okay. So therefore, this virus is called retrovirus. It carries its genetic material in the form of RNA, and it can cause its whole cells to synthesize DNA from the viral RNA. Okay, so that process is called reverse transcription. So let us look at the structure of the HIV virus. So on the surface of HIV virus, there'll be this glycoprotein, which is considered as the antigens. Okay, the antigens of the virus, the glycoprotein, GP120 and GP41. No need to memorize that. Just know that there are glycoprotein on the surface, and this blue color line is actually the envelope.
We want to talk with you all the time. Maybe
Martin, your mic.
Hello, what happened just now? Okay, I'm recording, right? Yes, I'm recording. Okay, so this blue color is the envelope which comes from the cell surface membrane of the host cell when the bacteria bud off from the host cell. Okay, so the host cell will be synthesizing virus, right? So when the virus bud off, it will take with it a piece of the cell surface membrane of the host cell. So this will form the envelope of this bacteria. And inside the bacteria, there are two layers of protein. Okay, the outer layer is called the matrix protein, and the inner layer is called the protein coat that you are familiar, which we call it as capsid. Right? Protein coat is used to protect the genetic material of the virus. So inside this green color protein coat, there are a few components. So these two lines represent the RNA. Okay, there are two RNA, two strands of RNA, which is genetic material of the virus. And then you've got three dots here, right? You've got red, green, and blue. All these three dots are three different enzymes. Okay, so red one is a reverse transcriptase, and the green one is the blue one is protease, and the green one is invertase. They must carry this enzyme because the whole cell cannot produce these enzymes. So therefore, they must carry this enzyme and bring it into the whole cell so that this enzyme can be used in the whole cells to synthesize new virus. Okay, so let's look at the HIV. So HIV is an RNA virus because it carries genetic material in the form of RNA, and it is called human immunodeficiency virus. When it enters the body, it will only infect T helper cell, TH cell. So the whole cell is T helper cell. Okay, so when it infects the T helper cell, it will cause the RNA to be converted to DNA. All right, so I'm going to show you the steps involved inside the host cell. So step number one, so I will illustrate all these steps using this diagram here. Okay, so this rectangle represents the whole cell, which is our T helper cell, because it only infects T helper cell. T helper cell. Okay, so the HIV virus has got the glycoprotein, surface glycoprotein. The glycoprotein will attach to this receptor on the T helper cell. So this receptor is called the CD4 receptor. So this receptor has got a name called CD4. Okay, so this T helper cell is also called a CD4 cell. So CD4 is because it refers to the receptor here. So after attaching, the whole virus will enter the whole cell, and then it will release its content, including the two RNA and all the three types of enzymes. So using the reverse, so step one is binding and entry. Step two is reverse transcription. So using reverse transcriptase from the virus, the RNA of the virus will be then converted to DNA. Okay, and this DNA will then be integration, means it will be integrated into the host DNA. So become part of the host DNA. Then transcription will happen, where this piece of DNA will be transcribed to RNA. So these are all the genetic material of the virus already. So they will all be produced. And then translation followed by proteolysis. So some of the RNA will be translated to form polypeptide chain like this. Okay. And after that, the polypeptide chain will be broken into smaller pieces to form the protein molecule. So this is a long chain, and it needs to use the protease. So this is where the enzymes of the bacteria, the enzyme, the virus being used here, reverse transcriptase. I use green color lah for enzyme. So this is reverse transcription. Transcriptase will be used here. And then invertase, sorry, what's called invertase? Integrase will be used here, also from the virus. And then protease will be used here, also from the virus. So they must apply this enzyme to the host that cannot produce those enzymes, okay? The main purpose is to synthesize the new virus. So this long chain will be broken by the protease into smaller proteins. And then all these proteins will be assembled together with RNA. And then after assembly of the molecules, then the molecules will bud off as a virus coming out from the whole cell, taking with it this external membrane to form the envelope of the HIV virus. Okay, so when this thing happens, then you can see that our T helper cell or TH cell now becomes a viral production factory. Right? And after that, it will die. Eventually, it will die after it multiplies the virus. So therefore, why is it that when a person is infected with HIV, their immune system is weakened? Because HIV is very smart. It attacks the T helper cell. So you know that T helper cell is like the manager. It's like the manager of our immune system. It's the big boss, right, of the immune system. So instead of attacking all the small flies, it go and attack the big boss. So now the big boss is being attacked already, and then the big boss cannot send information to inform the rest of the small flies in the immune system. Hey, there's this HIV. Please go and attack and phagocytose and kill the HIV. Your boss cannot do that because your boss is busily producing HIV virus. Instead of sending the message to other cells of immune system, it cannot send anymore because it's totally being hijacked by HIV, convert into HIV production factory. So therefore, immune system is weakened. So HIV is very, very smart to attack the big boss, right? So interesting, huh? Okay. So this is a transmission electron micrograph showing the budding of a virus out from the T helper cell. Okay, and this one is a scanning electron micrograph showing you this is actually our T helper cell in blue, and the small little red sphere are the viral particles that have been released out from the T helper cell, like this one green color. Okay, they've released from the viral from the T helper cell. So AIDS is acquired immunodeficiency syndrome. It's a collection of opportunistic diseases associated with immune deficiency caused by HIV. So I'm going to show you a graph on the right side. It shows you that from the first HIV infection, how long does it take for the person to develop AIDS? The person will go through 3 stages. Okay. First stage is called acute HIV infection. It means when the first time when the person is infected with HIV, he will experience acute HIV infection. So you look at the graph, there are 2 lines, the blue and the red. So the blue line is the number of T helper cell. Okay. So blue line is the number of T helper cell. Which is actually the manager of our immune system. Right, blue line. And then the red color line is actually the number of HIV. It actually represents the number of RNA, okay? So it represents number of HIV. So you can see that when the HIV first enters the body, its number will actually increase. Its number will increase because it actually attacks our T helper cell, converting into a viral production factory. So as these T helper cells start to release the HIV virus, its number will drop. So it will die. So T helper cell number drop, whereas HIV number increases. So that is the acute HIV infection phase, the first stage of HIV infection. Okay, later on, I explain to you the meaning of the word acute. Okay, later on. So second stage is asymptomatic period. So after the acute HIV infection, where the person will have got a symptom which is like a normal viral infection. So it's like the person will have got flu, okay, and then after that, fever, after that, okay already. So you think that you've got normal flu, okay, because of viral infection. After that, be okay. So when they're okay, the person will go into a second stage of HIV infection, which is called the asymptomatic period. It means the body has HIV, but there's no symptom. So the person may not even know that he's already infected with HIV. Okay, so this will be a long time, right? It can be 1 year, 2 years to 5 years. Okay, it can be a very long time. After that, only is the third phase. This is the serious phase when AIDS will start. Okay, this is called the AIDS. That means to say that why AIDS can start is because if you look at the graph, during the asymptomatic period, superficially we don't see, or physically we don't see any changes, but inside the body changes are happening. Okay, so what are the changes happening? You can see that the number of T helper cells are dropping, keep on dropping. And then the number of HIV virus is actually increasing slowly. So that means to say that HIV is continuously being produced by our T helper cells. That's why HIV number increases and T helper cells number drop. Okay, so that means the T helper cell, when is the onset of AIDS? Is when the number of T helper cells have dropped below this number. So that means when its number has dropped below this number. Okay, below this number. So this is when the onset of AIDS will happen. That means when the T helper cell is too low until it cannot inform the rest of the cells of immune system to launch the attack to HIV, it can no longer do that already. Then the AIDS will start, because then a lot of pathogens on the skin, on the tongue, okay, in the body can start to infect the cells and cause disease, because the immune system is already weak, because the big boss cannot send message to inform the rest of them. So that is when the AIDS will start. So why AIDS can start? Because the total number of T helper cells is so low that it can no longer launch an immune response, an effective immune response. That means it can no longer inform the macrophage, inform the T cells, the B cells to secrete antibodies, the macrophage to phagocytose the pathogen. So these two things cannot happen so efficiently. So that's why in infectious disease, the rest of the opportunistic infectious disease can happen. And then eventually the person can die. Usually a lot of people, they die from actually the opportunistic infection like TB. A lot of people die from TB or pneumonia. Pneumonia is another type of lung disease not caused by TB. Okay, so pneumonia. Pneumonia is actually lung infection caused by other bacteria. Okay, so I promise you that I will describe the meaning of acute and chronic for disease. So acute is a term to describe a disease that develops very suddenly and become very severe, and it will last for a short time, like flu, broken bone, and heart attack. Okay, suddenly occurs and very serious one, but then just for a short time. Whereas chronic is describing a disease that develops very slowly, and it may worsen over an extended period of time. It means the disease will worsen very, very slowly, such as osteoporosis. That means our bone becomes porous. Emphysema is when you can see that the alveoli in the lung starts to burst. One by one, it starts to burst, and the total number of alveoli in the lung become less and less and less because of smoking. So emphysema is also a long-term disease. Okay. So it's chronic. So this is a bigger version of the same graph showing you the 3 stages of HIV infection and also the number of T helper cells and the number of HIV. So if you look at the left side is CD4 lymphocytes, which is actually the T helper cell. On the right is a HIV RNA copies. So they are actually analyzing the total number of HIV RNA copies, which actually represents the number of HIV. Not exactly the same, but it's proportional to the number of HIV. Okay. Now, this is a very good diagram to show you, okay, this is a blood of person before HIV infection. Stage number 1 is acute HIV infection. I've got a lot of HIV particles in the blood. And then after that, go into asymptomatic period. HIV numbers are still there, but it's less, but its number will start to increase with time. And then the number of T helper cell will decrease with time. Eventually, when the total number of T helper cell is very low, it will be the onset of AIDS, right? Okay. So let's look at AIDS. AIDS is a collection of rare opportunistic diseases which develop due to immunodeficiency caused by HIV infection. That means these diseases usually, they are not common among healthy people. That's why they are rare. So they are only opportunistic infection when the immune system of the person is weak. All right, it's caused by A, yeast-like fungus, like the diagram on the picture on the right side is showing you the oral thrush. You see the patches of yellowish white color stuff, okay, on the in the mouth, okay, as well as in the tongue. So this is due to the fungus Candida albicans. Pneumonia is a kind of lung infection, and this one is caused by pneumocystic gyrovicide. And this one cannot cause disease to us, okay, because of a strong immune system. And it can also be opportunistic, can also be caused by bacteria, TB, Mycobacterium tuberculosis, causing a lot of people to die from TB. And also cancer. Kaposi sarcoma is a cancer of the skin, which is very rare. It is caused by herpes-like virus. So if our immune system is strong, Kaposi sarcoma, which is shown in this picture here, okay, Kaposi sarcoma is skin cancer. You can see patches of dark brown color on the person's skin, right? It's a sign of Kaposi sarcoma, okay? And also cancers of internal organs. Dementia is, it affects the brain, the degenerative disease of the brain until the person cannot really remember very well, cannot think very well, cannot communicate very well because the brain does not function efficiently anymore, dementia, okay? And also fever, weight loss, diarrhea, and sweating. Very similar to TB, right? You got fever, weight loss, diarrhea, sweating. TB got fever, weight loss, and sweating, okay? So how did HIV started in the world? So it said that in in the early 20th century, it is said that HIV spread from chimpanzees to humans. All right. And then the earliest case of AIDS appears in Africa is reported in 1959. And then it starts to become very common in 1980s, not so far ago. Okay, 1980s. How many years back? 40 years, 40 years back, okay? So it is a start of the epidemic in America, Europe, Africa, and Australia, 1980s. It became very serious. So just now I said that HIV is not being transmitted to everybody. It's not so easily being transmitted. So how is HIV being transmitted? It is by direct exchange of specific body fluids from an infected person to an uninfected person. So it's exchange of body fluids, right? So what kind of body fluids? Not all the body fluids. The body fluids which may contain enough HIV virus. So the semen and the vaginal fluid, okay, transmitted during sexual intercourse. So sexual intercourse can be vaginal sex, which is the normal one, or the anal sex, which is the not so normal one. Okay, both ways also can lead to exchange of body fluids, which is semen and vaginal fluid, and that can lead to transmission of the virus. I'll talk about it in more detail afterwards. Okay, blood. Of course, a person infected with HIV will contain HIV in the blood. So blood can be passed to another person through sharing of contaminated hypodermic needles. This is most common among drug users. Drug users who inject the drug into their body and they share the needles. And the needles are contaminated with the blood. Okay? And also contaminated blood and blood products. So someone donated the blood. So this person is HIV positive, but he doesn't know. So he donated the blood contained HIV. And then the blood can be used for blood transfusion, or the blood can be processed so that we only get the blood plasma from it, or we only get the platelets from it. So all these are blood products, and they will contain the HIV. Okay, so who will need the blood plasma? People who has got hemophilia, right? People with hemophilia. Hemophilia are people where there are lack of factor 8, which is a blood clotting factor. So they have to obtain this factor 8 from blood plasma of other people. So therefore, they have to get blood plasma to be injected into their blood to obtain the factor 8 to prevent the blood for not clotting due to internal injury. Okay, because their blood cannot easily clot. So we have to prevent the loss of blood due to cannot clot due to injuries. Okay, and also from mother to fetus and children is one of a very common way. So mother to fetus via placenta, mother to child during birth, mother to child during breastfeeding. So all this can transmit from mother to child. So usually common transmission, right? It starts with, say for example, sharing of needles. Okay, so this person take the drugs through the needle and then share this needle with another person. Also take the drugs with needle. And after that, HIV transmit to this person. This person go home and meet the wife. Okay, and then they have got sexual intercourse. So transmit to the wife. And the wife get pregnant. And the wife transmit to the children. So this is a very common way of transmission. And of course, if it's not through drug users, then it could be homosexual. Homosexual means two people of the same sex, right? They can have got sexual intercourse. So for male, they must have got anal sex, right? Correct or not? For male, only anal sex possible. There's no vagina for you. So only anal sex. So after anal sex, this person go back to the wife. I don't know why. It can pass like this also. Okay? So many ways to pass. Right. So the innocent people are the mother and the children. Right? The mother and children. A lot of mother children she get, not because of they go and not because not because of deliberately get okay, they get without knowing. Okay, right. So why HIV is only transmitted via specific body fluids? Because only these body fluids that we mentioned earlier on just now, right? The vaginal and semen, okay, and then the blood, and then the milk, okay, contain enough virus to be transmitted. Okay, under no antiviral therapy. I'll talk about this one later on. Okay, so the body fluid must contain enough HIV virus to be transmitted. So why HIV can be transmitted through sexual intercourse? Because the HIV from semen and vaginal fluid can pass through the wet skin covering the foreskin and urethra of the penis, vagina, cervix, anus, and rectum. So these are the areas that will be involved during a sexual intercourse. Okay, it depends. So if there is, and they say that the virus can pass through the wet skin. That means it can pass through this skin that is wet around this area, the skin of all these areas. So that's why it can be passed from the body fluid, which is semen and vagina, into the body through this skin of these structures. Okay, why? They are very thin. Now we got two types of skin. We got the wet skin and the dry skin. The dry skin are the one that are found all over our body, right? Our hand, our face, okay, our legs. These are dry skin. The wet skin are the skin that are found here. It's mentioned here. Okay, why? Because the surface of the skin is always moist. It's always moist, okay? Because mucus being secreted on the surface. So like this one here. So this is our wet skin on the left, and on the right is the dry skin. So on the wet skin on the surface is epithelial cell facing external environment, okay? So exposed to HIV, HIV can cross the epithelial layer of the mucous membrane. Mucous membrane means the wet skin because it got mucus on it, and then it can enter the body, and then HIV will infect the immune cells, which is a T helper cell, and start to replicate inside the T helper cell. And then once the virus is released, it can enter the blood and lymph vessel and spread to other parts of the body, and the person will have got permanent HIV infection. Okay, whereas dry skin is the one on the right side. On the surface of the dry skin is quite fibrous because all the cells on the surface are dry. Okay, whereas this is a wet skin. Okay, so this is a micrograph showing you anus on the left side, and then on the right side here is the rectum. Okay, anus is an opening into the rectum, and it's showing you the mucous membrane. So of the anus mucous membrane is stratified squamous, whereas for the rectum is only simple columnar. Simple columnar means only one layer of cell. Very easy for the virus to pass through. Okay, and also you see, doing anal sex is more dangerous than vaginal sex because number one, it is not lubricated. So during the sexual intercourse, it may cause the skin to tear, the skin on the anus and the rectum to tear. And whenever there's open wound, it's very easy for HIV to enter. Why? Because it's too dry. It tears because it's too dry and because of the friction. Okay. And other than that, also, there could be some wound already existing before the anal sex. The wound can be due to injury from other microorganisms, that is STD, sexually transmitted disease, wound from surgery, wound from enema. Enema is a method that is used to clean the colon. It's a method to clean the colon where a tube is placed into the rectum, and then water is being flushed into the rectum to the colon, and the water will remain there for about as long as possible, 10 to 15 minutes or 20 minutes, and then the person will go to toilet, and then it will go to toilet and flush it in the toilet bowl. Okay, so that's called enema. So during enema, injury can happen because you try to put the tube into the rectum. So if you don't lubricate the wall of the rectum with oil, you just put the dry tube into the rectum, it may actually injure the skin. And after that, if there's anal sex, it's even easier for HIV to enter. Okay, so anal sex is very dangerous one because the skin layer, you can see now, it's only one layer of cell. It's very easy for HIV to enter. Okay, and some more is dry. Okay. Transmission through sexual intercourse. The initial epidemic in North America and Europe was among the male homosexual because they do anal sex, right? The transmission is very easy through anal intercourse. And they have got many sex partners. Usually for homosexual, they may have got a few partners. So that's when from one person, it can immediately spread to a few person because it got many sex partners, okay? The mucus lining of the rectum is thinner than the vagina, and also it has got less natural lubricant. That means there's no extra mucus being secreted during sexual intercourse. So that's why it's very easy to actually dry and friction and tear, okay? So damage can happen during intercourse and the virus can pass from semen to the blood. And also from the homosexuals, they can be donating blood and then spread to the blood recipient, right? They can also be heterosexual, so they can spread to their girlfriend as well as their wife. So hence sexual intercourse is the main method of transmission. Okay, so why I'm showing you this diagram is because now we're going to look at the treatment of the disease. So just now we said transmission, right? Here we want to talk about treatment of disease. We use antiretroviral drugs. Antiretroviral drugs, okay? So what does the drug do is it does not kill the virus. So we cannot kill the virus that's already in the body, okay? What the drug can do is the drug can prevent the virus from replicating. So the viral number will not increase in the body when the person starts to take the antiviral drug, okay? So there are a few ways the drug can act. So if you know how the HIV infect the cell and cause the cell to produce the virus, this is where the target of the antiviral drugs, okay? It can target to prevent the binding and entry of the virus. So it can prevent the binding here, okay? So it's called entry inhibitor. Then you've got reverse transcription inhibitors will prevent the conversion of RNA to DNA by inhibiting reverse transcriptase. And then we've got integrase inhibitor that will prevent the viral DNA from being integrated into the host cell DNA. And then we have got protease inhibitor, which prevent the protease from breaking the polypeptide chain into smaller proteins. Okay, so these are the various ways that the antiretroviral drugs in the market are now working. It does not kill the virus, okay? So I'm showing you an example of a classic antiretroviral drugs. It's called AZT. Okay, AZT is a very classical drug. AZT stands for azithromycin. Okay, now thymidine is what? If you look at thymidine, thymidine is actually the nucleoside, which is made up of the sugar and the nitrogenous base of our nucleotide. Okay, so thymidine. So the drug is very similar to the thymidine, but with one component that's different here. You see this part here, in a normal thymidine, it is OH, whereas in AZT, it is NH3. So normally when during DNA replication, you know that the nucleotide will be added together, right? So the phosphate, sugar, and nitrogenous base. So this is one nucleotide, right? And you got the template here to guide you what is the base that you're supposed to add in. Okay, so this is the template. So this template is the viral RNA in this case. So this is the viral RNA that's used as a template to synthesize the DNA. Okay, so now usually the next nucleotide will come in and it will sit in here, right? And this is not complementary base pairing. So during the DNA synthesis, that means during the reverse transcription, when you want to produce this DNA, which is a polynucleotide strand, when it picks up the AZT here, so let's say the next one is an AZT. What happened is, so it picks up the AZT. So this is an AZT here. Then there will be a problem. I think I draw wrongly. Yeah? I definitely draw wrongly. So, okay, the N is supposed to be here. Okay, the N is joined to the sugar. N. Okay. N. Okay. So once it's added in, look at the sugar. At the base here is NH3 instead of OH. So when you got NH3 attached here, okay, NH3, yeah, then the phosphate cannot form bond with NH3. The phosphate can only form bond with OH because remember your phosphate comes in, it also has got an OH. So hydrolysis, therefore hydrolysis can occur. Okay. So hydrolysis can occur and to remove the water here, HHO. But now if during the reverse transcription process, AZT is added in here, AZT, the sugar number, carbon number 2 of the sugar is carrying NH3. So therefore, this type of condensation reaction, condensation, right? Yes. This type of condensation reaction cannot occur. So therefore, the chain elongation will stop here at the AZT. So therefore, the viral DNA cannot be synthesized by reverse transcription. Okay? So this is how the drug works. Now, usually the patients are not given only one drug. The patients will be prescribed with a combination of drugs, okay, a combination of antiretroviral drugs. So it's called combination therapy or HAART in order to increase the effectiveness. So what is HAART? I will mention in the subsequent slides, okay? Okay, so I'm going to show you some findings in Malaysia. This is a talk given by Dr. Christopher Lee that came to our college many, many years ago. So he actually reviewed the data in Malaysia, okay, the data for HIV in Malaysia. So HIV pandemic is evolving. So it has become a chronic disease and it gives a long-term survival due to the treatment and improve quality of life. Okay, so what do you mean by long-term treatment and improve quality of life? I have to bring you back to here. You see, why the person that has got HIV infection goes into the third stage is because of the decreases in the number of T helper cells. So when the person is diagnosed to have got HIV infection, the person will be put on antiretroviral drug therapy. So let's say, for example, at this stage is when the person went for diagnosis and is being diagnosed of, went for screening, okay, screening for the presence of HIV and is diagnosed of having HIV positive. He will be given antiretroviral therapy starting from this time onwards. So therefore, from this time onwards, the virus can no longer multiply in the T helper cell. So the T helper cell numbers remain at this level from this time onwards when the antiretroviral drug is being administered. So therefore, this person can live very long and he will not go into the third stage of HIV infection. That means there will be no AIDS for him. Okay, he can live normally and healthily for a long, long time. Say, for example, when a person has developed the symptoms of AIDS at this stage, so after that, he's being diagnosed of having AIDS at this point, and from this point onwards, he's given the antiretroviral therapy, ART. So that means his T helper cell will remain at this level and it will not continue to decrease. So that means the person's opportunistic infection will not worsen. It will not worsen anymore because the number of T helper cells will now be maintained at that level onwards. So can you see it's very important to have got early diagnosis and treatment. The earlier it is, the better is the quality of life. You can maintain the T helper cell at higher level the earlier the person is being diagnosed. So therefore, one of the prevention methods in HIV is called contact tracing. That means when a person is diagnosed of having HIV, then this person must report who are the people that may have got the risk of being infected from this person through probably sexual intercourse, through sharing of needle, through maybe from mother to fetus or breastfeeding. So this is called contact tracing. And after that, go to screen to see whether it's HIV. If got, you have to put under the treatment. So antiretroviral treatment. Okay, so that will maintain the quality of life. So what is HAART? HAART is HIV active antiretroviral therapy. HIV active antiretroviral therapy. So what do you mean by HAART is that you give the a few combination of antiretroviral drugs. So this is called HAART. HAART is more effective than a single drug. Okay, so you see here, this is data showing if we only give AZT alone, the number of HIV RNA will still remain quite high. But if you start to give a combination of drugs or treatments, you can see HIV number will drop. So this is even better. You use AZT, 3-TC, and a protease inhibitor. So this is another type of drug here. So 3 different kinds of drugs is more effective than only a single drugs or 2 drugs. So this if you use a combination of drugs, is actually called the HAART treatment. Okay, so it's more effective than only 1 drug. So this picture actually shows the effect of this woman that has been given the HAART treatment. You can see that now she looks more normal compared to over here, very thin. Okay, because she has got MDR TB. So that's why TB causes a person to be thin. So after the treatment, the immune system has improved. So you can see this person also becomes, looks nicer. Okay. So this is showing that the higher the number of antiretroviral drugs given, the lower is the risk of dying. So when you use 3 drugs and above, it's called HAART. Okay. But the problem of the drug is very expensive. Can you imagine this person has to take this drug for the rest of the life? For the rest of the life to maintain the T helper cell at a high level. Okay. And the side effects is not nice at all. Okay. Mild and temporary side effects like rashes on the skin, like headaches, diarrhea, and permanent side effects like nerve can be damaged, abnormal fat distribution in the body. Okay, so these are the side effects. These are examples of the antiretroviral drugs that are found in Malaysia. So we've got actually many of them. NRTI and NRTI, whatever it means, protease inhibitors. Okay. RT stands for reverse transcriptase. I stands for inhibitor. Okay. So how do we prevent and control the transmission of HIV? First, prevent transmission by sexual intercourse. So use a barrier between body fluids so that the body fluid for another person will not come into contact with this person's body. So use barrier method like condom, femidom, and dental dam. So you know as condom, right, you have to wear it at the penis. Femidom, you have to put it into the vagina. Dental dam is you put it onto the genitals if you want to do oral sex. Okay, so that whatever fluid doesn't go into your mouth, for example. And also, please have single partner, not multiple partner. Okay. If you've got multiple partner, it'll be like this, from one person spread to many people all over the world. Okay. Do not use prostitute because you do not know their history. Okay, those people who go to Bangkok for prostitute, be careful. Okay. Contact tracing, very important, right? HIV, so contact tracing for HIV testing for high-risk group. So male homosexual, prostitutes, injecting drug users, as well as the sexual partners must go for HIV testing. Education is the most effective way so that they know how to do prevention. Just use condom, use femidom, use dental dam is not very common. You can make dental dam from condom or femidom, okay? Just cut them out to be a small piece will do. So educate people about what? About how to prevent HIV transmission, like using all this barrier method and effectively decreasing the rate of HIV infection across. So education can decrease the transmission of HIV across the whole society. Okay, this has helped to decrease HIV by 25% between 2001 and 2009. So in 9 years already decreased by 25%. Okay, then of course, what about those intravenous drug users? Please prevent sharing of syringes. So therefore, in the developed countries, right, they have got this needle exchange scheme where the used needle can be exchanged for a new needle. So that will prevent actually sharing of syringes. And educate them, okay? Educate them about not sharing needles. Educate them about they can exchange needles, okay? So they don't have to buy it. Whereas for the blood, right? Screen the blood for anti-HIV antibodies. That means you want to know whether the blood contains HIV. You can either screen for the HIV antigen. Nowadays, they screen for RNA, okay? Or you screen for anti-HIV antibody. So you can either screen for antigen or screen for antibody. Because at once your body is infected with HIV, your body will produce the antibody. So you can look for the presence of anti-HIV antibody instead of the antigen of the virus. Both ways also can. Okay, so if you detect that this blood has got HIV, then heat treat the blood to kill the virus. So this is a routine screening, that has to be done for all the donated blood. So of course, for developed countries, we will do that. For those poorer countries, we will not know whether the clinics or the hospital or the blood bank will actually screen the blood and heat treat it if there is the virus or even throw it away. We do not know. Okay, but for us, yes, we will screen the blood for certain diseases. Okay. And of course, so in those underdeveloped countries, if you want to go for surgery, it's better to donate your own blood. Plan ahead. Let's say you plan for surgery 3 months later. So start to donate your blood now so that during surgery, if they need blood transfusion, they will take back your own blood to use rather than any other blood of the source that you do not know. And of course, try to don't use blood products. Use synthetic blood product. That means it is not from a person. It is synthesized probably in the factory or in the lab. So it is free from microorganisms. Okay. Now, this is another thing is very important. A high percentage of mother and children in Malaysia that got HIV infection, okay, is because mother get from father and then mother pass to child. So there are 3 routes that mother can pass to child: during pregnancy through the placenta, during labor, as well as during breastfeeding. So at birth, 20 to 30% infected with HIV. So 20 to 30% of chance being infected. And then if breastfed, 30 to 45% of chances being infected. So it's very, very high. So therefore, they have to be targeted to give treatment. So pregnant women will need to undergo HIV test as early as possible. And then the HIV positive mother will be given antiretroviral drugs in order to reduce the number of HIV, okay, preventing them from multiplying so that the numbers of HIV are low enough that it will not be transmitted to the fetus through the placenta, as well as during labor, it will not be transmitted. And then if the mother breastfed the baby, also have to be given the HIV antiretroviral drugs, okay? And also the babies born to a mother HIV positive will also be given the drugs right away for 4 to 6 weeks, just in case any HIV happen to enter the blood, it will stop them from multiplying, okay? And then the immune system then can actually remove them, okay? So usually in developed countries, mothers with HIV positive are discouraged to breastfeed because they can just give formula milk. But in the underdeveloped countries, usually they don't have clean water supply. So it's better to breastfeed the baby than to prepare the milk, okay, using unclean water. And probably they also cannot afford to buy the formula milk, okay? So treat both the infected breastfeed mother and baby with the drugs, okay? So this is the adult HIV prevalence in 2018 in the world. You can see that most of it is found in this South Africa as well as in the Middle and West Africa. So this region is considered as Sub-Sahara region. This region is considered as Sub-Sahara. Sub-Sahara means below the Sahara Desert. This is Sahara Desert. I think it's around this region. So below it is the Sub-Sahara region of Africa. Okay, so why is the number so high here? It's because of what is this? Because of the country that's very poor, so they don't have got good medical facilities to do the contact tracing, okay, to provide the treatment for the patients. So that's why the numbers are very high. And plus, on top of that, the immune system may not be strong because of poor. They cannot get enough nutrients to maintain a strong immune system. Okay, so because of that, this region have got very high number of cases of HIV. And also, of course, education-wise, people may not be educated of the simple way of prevention and control through sexual intercourse. Okay, so that's the reason. So this is a number of cases of HIV in Malaysia, right? Starting from 1988, 0, and start to increase in numbers and keep on increasing, and then start to drop when people are being educated, right? And this is age distribution of HIV. You know, HIV usually affect people who are sexually active and they don't perform safe sex. So you can see that people who are affected are usually people at their prime age, which is 20 to 39. So this is the age where people are the most strongest and it becomes an active workforce in our society. So when they are the one that are affected, when they are sick, they cannot work. So that will lead to economy problem for the country. Economy problem for their family. Because when they are sick, not only they cannot get income, they have to spend money to see doctor, to take the medications. Okay, and then their children will also be affected already because parents may die from the AIDS and then the children will have no one to take care of. So it will lead to a lot of social diseases. Okay. This is HIV route of transmission in Malaysia. Mainly is because of venous drug user. Okay, intravenous drug user is the main cause. And then men who have sex with men is the second cause. And then from mother to child is the third one. So mainly it's drug users who get in Malaysia. Then we've got homosexuals and mother to children. Okay, so the number for drug users, the number are still very high. Drug users who get HIV. And then heterosexual is increasing. Mother to fetus vertically is the one that increases the highest because they do not know they have. Okay, so with that, I will stop the lesson for today. So we are going to recap this HIV and AIDS. Okay, pathogen is human immunodeficiency virus, HIV. And the method of transmission is in the body fluids, in semen and vaginal fluids during sexual intercourse, in the infected blood or blood products, contaminated hypodermic syringes, mother to fetus across the placenta at birth, and mother to infant in breastfeeding. Global distribution is worldwide, especially in sub-Saharan Africa and Southeast Asia. Incubation period, initial incubation is a few weeks until the symptoms starts to show in a person. And after that, it becomes asymptomatic period. So about 10 years or more before symptoms of AIDS may develop, which is the third stage of the HIV infection. Okay. Then the site of action of pathogen is the T helper cell mainly, can also affect macrophages and brain cells. Clinical features of HIV infection is flu-like symptoms and then symptomless. And then in the third stage, AIDS has got a lot of opportunistic infections, including pneumonia, TB, cancers, weight loss, diarrhea, fever, sweating, and dementia. Method of diagnosis for HIV is testing the blood, saliva, or urine for the presence of antibodies produced against the HIV. It's easier to detect antibodies than antigen because antibodies concentration that's produced by the body will be higher than the concentration of HIV. So it's easier to detect antibody rather than the HIV antigen. So that's all for today. We have learned about HIV. Thank you.